The thing that I think is really wonderful about these decision aids is this is not a taped lecture by a physician. You're just repeating what I said in the office. These are patient stories. And there is nothing I can say in the office that replaces watching a patient similar to you with your same health problems who's made a decision on a treatment plan or a screening test. That resonates so much more deeply.
It's very hard for a patient to understand statistics and epidemiology and values and choice all in one visit. And the decision aid ahead of time really helps them process many things so that they can actually come to a decision and understand their values and help and put me in the role of trying to help them understand their values better. And that's probably the best place for that to happen.
Well, this absolutely takes the burden off the physician. The physician doesn't have all day long to sit and spend with the patient describing all of the various intricacies of a decision aid. Having a nurse be able to spend quality time with the patient, explain it, and only bring those important pieces back that the patient didn't understand back to the physician saves a ton of time.
What we discovered in one of our practices that has predominantly female physicians, that having the decision aids saved 20 minutes on a visit, that they felt like people were getting the information in a very unbiased manner, and they were getting their answers to their questions, very personal questions and things that maybe they wouldn't ask in a visit even with a female physician. They were able to go home, watch the DVD privately, think about things, and come up with solutions that fit in with their lifestyle and their values. So we found that very valuable.
In our experience, this has definitely reduced the amount of time physicians have spent in unproductive office visit encounters with patients. It does take time, but it's somebody else's time. And somebody who's more qualified to do this, wants to do this, already probably, in our clinics anyway, probably already has a relationship with that coach if they have other chronic diseases that they've already been working with them on. So it takes their time, but they're working also very hard on how do they do that efficiently as well. So I think that overall, it's hard to quantify that for sure, but I think overall it saves time throughout the whole office. We don't get the unnecessary phone calls, the unnecessary office visits to yet talk about it another time. The coach really can step in and help streamline a lot of that.
I think the biggest value to using a decision aid with a patient is the fact that it makes the patient a more informed partner in their own care. They understand what's going on with their condition or their anticipated surgery, and it makes them just a better partner in the whole procedure.
When we were doing our study with women with breast cancer, every one of them was scheduled to come to our center, and so they watched the video there, and with often their partners or their spouses or their children, whoever was with them, and so they would walk out of the room after they'd watched the video, and mostly people take it home, so I don't get to get their immediate emotional reaction to it, but it was not unusual for women to be kind of in tearful. Because they were so thrilled to get this information, and it was really giving them exactly what they needed to think about a really scary, hard new diagnosis. But the thing that I liked almost better than that was the partner or the spouse would come out of the room and just shaking their head and saying, "That was so great, because now I know exactly what she knows, and so I can support her with this, knowing the same information. I understand what she's basing her decision on." So that's been wonderful to hear that over and over again.
I work with patients who are men, age 50 and older generally, and they have a condition called BPH, which stands for benign prostatic hyperplasia. In other words, it's enlarged prostate. And sometimes they bring their spouses, sometimes they don't. But what they're there for is to hear about the condition of the enlarged prostate and what are the treatment options. And a gentleman that came to see me said, you know what? And he looked at his wife and he looked at me and said, I've never told anybody this, but now that I've heard about the options available for me, I just gave up my Gopher tickets and I didn't have to do that. And what he was referring to was the University of Minnesota. He was an alumni, a very avid fan of Gopher basketball, and he had given up his tickets because he knew that he couldn't sit through a game. He had to get up, go to the bathroom so frequently that it just wasn't worth having season tickets. And that was an aha for him in that, wow, this is a really valuable experience to come and learn about my condition as well as learn about that I can do something about it. And so he was going to go get season tickets for next year after he made a decision on what he wanted to do.
We started working with our surgeons who do hip and knee replacements, and we had one who was a young guy who had just come on board and was a great champion, and then this was a friend. I think they trained together, and he came on a little bit later, but he was, you know, involved with the project and trying to be supportive, but I think really he was just going along because he thought he should. So one day he came and confronted me out in the hall in front of my office and said, Kate, I sent you a patient the other day to borrow the video for knee osteoarthritis, and I already had him booked in the OR to have both of his knees replaced. I wanted to make sure he had this good information, so he came and got the video, and he and his wife took it home and watched it, and she called me the next day and said, we're canceling the surgeries. And to me, this was a win for the patient and his wife, who, when they were informed in a fairly objective way about all their choices, decided not to go through with the surgery. And the surgeon said, you know, if I'm losing business. And I said to him, now come on, this is a guy with knees that hurt. He'll be back to you when he's ready. And that's when you want to operate on him, isn't it? And he looked at me and he thought, oh yeah, you're right. So I think it was a win for both of them, and I have to say that after that conversation very early on, I've never heard another complaint from him, and I have a feeling he still has a 3-month wait list for people who want to have their knees replaced.
We had one urologist, and he was new to the clinic, and so I was coming at him with, here's a new idea of how you could do things differently. And this was a pretty successful provider who was very popular and did a good job. But he had an openness to thinking about doing things differently. But he was a little bit skeptical of, do I really need to change? And so we developed the project and talked about how to implement using decision support in his practice. And as we went through doing that and got the program up and running, you know, when you get about a month or two into a program, there's this kind of watershed moment where people are starting to really do it. And I was, you know, not completely sure how he thought it was going. And one day I got a telephone call and there was a voicemail and it was from him. And I was fearful that it was going to be the, I don't like this, I don't want to do this voicemail, we need to stop. But instead, it was Tom saying, I really love this. This is great. It's making my visits more effective, more efficient. I'm really feeling like the patients are getting a lot out of using these decision aids. And as he recognized that it was giving a lot of value to his practice, his enthusiasm went way up. And so he became just an ardent supporter of the concept and the value in it. And his reaction was, I want to do more. What about some other things that we could do this with? And so that was a really exciting moment.
I think that one of the real challenges is to address skepticism on the part of providers that this in some way replaces our conversations with patients and replaces the decision making that we would make in the office together, and really frames the use of these aids as another tool to enhance what we do and to get over providers' concerns about not perhaps having control over the content of the videos or in any way replacing their essential job as a doctor. The other thing I think is going to be really important is to figure out even more ways where this is going to save us time as providers and taking it off the plate. I'd prefer not to ever have to make the decision about sending a patient a decision aid, but rather have, for example, for cancer screenings, that already be done ahead of time. And they've watched the video before their 50-year-old physical, and then we can just have a really well-informed discussion at the time of the visit. So that's what I see as some of the opportunities to make this really well accepted.
I think what's changed most is our patients. And actually, we have a lot of work to do to bring them along in this new system. We spent a lot of time initially educating our patients on what this was about, because this was not a service they were even used to receiving in a doctor's office. And to kind of be given permission that we want to hear your thoughts about this, and we want you to make a good decision that's right for you, and then we'll come together and talk about it. That's a whole new service that we're even providing in our clinics.
When you tell them you have time to make this choice, you need to think about what your options are, and you need to learn about this so that when you come back to talk to the specialist, or you come back to talk to your primary care provider about what to do, you'll be ready to actually have a conversation about what your preferences and values are, rather than trying to learn facts in a short window of time. Then it makes the whole conversation richer and more effective.
My favorite decision aid story, and the time when I really became a convert to using these, was taking care of a man in his early 50s, originally from Haiti, who was a groundskeeper in the town where I worked in the health center. And we were having a discussion about colon cancer screening and the procedure of a colonoscopy. And I told them that I had a video, and I was thinking these videos have just come out, I've got to figure out how to use these, that I was going to send him, and I'd like him to watch it and then let me know what he wanted to do after we'd had an initial discussion about the pros and cons of screening. And he watched the video and called the office and said he wanted to schedule his colonoscopy, which we did. And then about a week before his colonoscopy, he called the office and said he wanted the video again because he'd already returned it. And shrugged and said, sure, that's fine, thinking maybe he was rethinking things, or I wasn't sure why he wanted to watch it again. And so after he had his colonoscopy and I saw him back in the office, I said, well, you know, you called and asked for that video again. Why was that? And he said, oh, my daughter wanted to watch it with me because she knew I was going for this test. And so I watched it with her, and then we went through a few of the things in the video. It helped her understand what I was going through. I thought, well, that was really helpful for them as a unit, and she has better English skills, and it was actually, I think, a really good facilitation of his decision, or rather affirmation of his decision. But the part that I always laugh about was a few months later at his annual visit, I told him that there was another cancer screening test that we should talk about, and that was prostate cancer screening. And he can tell probably that I'm about to launch into a long discussion. He says, stop, doctor. Do you have a video about this? I'd rather watch a video, which I thought was actually quite funny, a little humbling. And I sent him the video, and he made his decision on prostate cancer screening after that. So after that, I realized that you can use these videos even when you think it might not work. If somebody maybe English is not their first language, or it's a complex decision, and that somebody who in his case wasn't used to discussions about cancer screening, it actually worked beautifully within a family unit to teach them all about cancer screenings, and it actually was far better in his case than me telling him about it.